want to say I've known I've liked guys since elementary school, but I never really acted on it. Even through middle school, I didn't act on it until high school. My parents actually took it pretty hard. I definitely knew I needed support. I don't really like to talk about my feelings. It was getting to a point where I was like, I feel like it's overwhelming. Like it was like a weight just taking over me. I think the role that Fenway and the Borum play in terms of like youth seeking services is once you get the services, not only do they provide you, but they empower you. My relationship with my family has improved dramatically. They're one of my biggest supporters now. They've come to a few appointments that I've had at the Borum, like when I've gotten checked up. They've even met my partners. It's been a really good journey. It's definitely been a good journey.
Back when I was 16, I had a physician who was fairly old and very much not interested in talking about anything sexual. I needed to have a physician I could ask questions, I could educate myself, I could become armed with the information that I need to get through this world and make it through unscathed. My first encounter with Fenway was actually at the Borum. I found it convenient, easy to obtain health care, easy to obtain what I needed on the spot. No questions, no waiting, no appointments, that kind of thing. I think the services that I was able to get at the Borum enabled me to be more comfortable with who I am. It showed to me that I was not a freak, that I was not so unsavory that I couldn't get medical care. I was able to go someplace and it was welcome, and I always knew I was different, but I was welcome to get my care there, and it was no problem at all.
What makes the Borum a really great space is that they have dealt with other people who are trans, like this is one of their specialties. I've dealt with a lot in the past year, like I've been like kicked out and lost my family, but I feel like I've gained a lot, like I'm happy with myself. That was like a long process of going from like hating to like loving myself and like trying to just like persevere through all the oppression. When you come into the Borum and you see all the staff, they're like happy to see you and they know who you are. And they truly want to see like all of us, like I think, succeed in life. And I think that's what makes them different and also what makes them the best in trans healthcare.
Prior to enrolling at Fenway, I went to just a family pediatrician and University Health Services. When I first found my PCP at Fenway, it was kind of like a whole different world. It was really unique to me to find an institution that both provided care and also engaged in research to identify public health problems that were going on with specific LGBT populations. Yeah, okay. I think looking around at the other clients as you wait in the waiting room to be called by your physician, it's really interesting for me to kind of feel that connection even with these random strangers. You know, we're all seeking something, and Fenway provides a kind of alternative space that is maybe what we're all looking for. Youth is like a very precarious time. There's a lot that could go wrong, and I think Fenway has kept me going. It's kept me, you know, working towards long-term goals, towards making long-term goals, having meaningful relationships. I mean, it's life-enabling. I don't feel like I would be, you know, the truest expression of myself without the care that Fenway's provided over the past 5 or 6 years.